Hi, everyone. Welcome to my channel. Tonight we have a special discussion that I'm very excited about, addressing the Black maternal mortality crisis in the US, which is a very serious issue, and it is World Doula Week. So we are celebrating the work of Black doulas. We are uplifting the amazing life-saving work that they do. And I have three incredible Black women doulas here for this panel discussion. But I will pass it to Coach Yolanda to introduce herself, and then Dani, and then Dee. And we'll get started.
Right. Hi, everyone. Thank you so much, Marissa, for bringing this panel together. I am Coach Yolanda. Among the many titles that I hold, a birth doula, certified birth doula, is one of the precious titles that I hold. I became a doula after witnessing my daughter give birth to my first and only grandchild over Zoom. It was during the pandemic. And to
Wow.
sit there and watch and hear her explain what was going on with her body and no one listening was more than I could handle as a mother and a grandmother. And I thought, I don't want anyone else to have this experience, as well as just having my own experiences bringing children into the world 30 years ago. And to think we haven't quite got that together yet.
Mhm.
And so I trained with Common Sense Child Birth out of Florida with Jenny. Most of you know Jenny. She is a champion for midwifery. And I'm just grateful that the creator has led me into this space to be able to use not just my personal experience, but professional experience supporting women, particularly Black women, in advocating for themselves and their children. And so being a doula is not just about the birthing process, it's a life process that can absolutely impact families and communities, particularly when we're not listened to, we're not heard, and we internalize that as somehow being our fault or something wrong with us, or thinking that this is the way it's supposed to be when it is not. Every being deserves to come into the world in a loving, supportive environment. And I think that's what the role of a doula is and ultimately should be.
Wow. Thank you so much.
You're
Dani,
welcome.
please.
Yes, that's so beautiful. Thank you so much for beginning us off with like what is a doula and how can they be in your life? Ooh, in such an impactful way. My name is Dani. I am a doula. I love saying that. I do a multitude of things. Currently operating as a therapist. I'm also a yogi. And so there are multiple things that I offer the world and this community, but first myself. So to me, what a doula and I'm actually coming up on my 1 year anniversary of being a part of my first childbirth. And I was able to do that at a local birth center. And so, and Guild of Doulas is my doula business that I am building from the ground up, or from my brain, from my spirit, from a seed, from an idea, and I'm making it into a service that I can be able to offer doula services that range beyond childbirth. I definitely enjoy postpartum, also prenatal yoga I've been tapping into as a service that I offer, and also reparenting services. I think reparenting doula is a very interesting title that I'm
Mm.
playing around with, especially because I feel like a doula is someone that holds space for you during a moment of transition. They hold that sacred space. They are there as a source of knowledge because they have taken time in their life and have lived a life to build experience to be able to share in that moment with someone else who is really vulnerable at that time. And so I believe that does range beyond like, childbirth and postpartum. I started thinking about reparenting even because that involves some of my therapy background and even just being an eldest sister and even bringing in my own experience. I was born 3 pounds. And so I know that there are lots of preemie babies that did not make it, or mothers that did not make it through that process, and I'm very grateful I did. And so that's my personal interest in continuing to research and learn more about resources that I can share with my community, whether I'm not using them for myself at this point because I'm not a parent yet. I am more than happy to learn about those resources anyway and be able to share that with my community. So, yeah.
Thank you, Dani. Dee, please.
Well, I want to say thank you for inviting me into this space. I'm Dee. My online presence is Big Sis Doula on YouTube. I have been a birth keeper. I'm embracing that term more than the doula servant term that most people are aware of. I am embracing birth keeper because I think the work does cover a broad spectrum, as my doula sisters here have described. As an ever learner, sometimes many of us start with a birth experience that says, I want people to have what I had, or I want people to have other people to have better than I had. And I think I was in the space where I thought that I had had an optimal series of births. My husband and I, we have 3 children. And I thought I had, and it's not until you learn what physiological birth looks like and where you can stand in your power and truly be heard that you recognize there's an undercurrent, a power relationship happening, and that you don't need to embrace the crumbs that are offered. You can stand and assert yourself in a space. And so I started with birth work. I now have embraced full spectrum doula work. So infant loss, and a lot of the postpartum work that I think that is unseen, unspoken, that a lot of women either are in isolation because people are more focused, hospital staff, family members, friends are more focused on the baby than the mother. So I see the doula role there being very unique. But the term doula is really expansive. And I want to make sure in this conversation that I say that I am currently studying as an end-of-life doula. And so there are many points where the work of coming alongside of individuals going through an experience, we act as, if I can use a church term, we're ushers. We are those who create the facilitation of these are what your options and opportunities are. Can I magnify your voice, not speak on your behalf? And that is where I think in the maternal health crisis specifically, families are needing this support, but also in end of life, sometimes family members are caught up in their own emotions. There's a lot happening, a lot coming at them. And a doula that is very familiar. I've been in this 11 years. I've had almost 100 births and birthing experiences. When you can see you get to a point where you're seeing more and more, and that is the benefit, as well as the training, the investment that we make in childbirth education, lactation, families experiencing loss, trauma-informed doula. We are usually very well trained to be able to help families, and that's what I want to offer this conversation is, yes, the birthing time when you are in labor is where most folks think of us. But I've gotten calls from I have a positive pregnancy test to I'm at the hospital and they're not listening to me. Can you come and help me? So we and into the postpartum time where moms feel alone, isolated, and are dealing with mental health. I want to make sure that we're touching those parts of this crisis conversation.
Mhm.
Thank you so much, Dee. You mentioned something like not accepting the crumbs that were offered. And I kind of want to ask around that, like, how do you all see your role in advocating for Black maternal health within these institutions, these hospitals often that don't often see us as human? I mean, just starting there. How do you see your role as doulas in the birthing process? And then, as you mentioned, Dee, like doulas can have an expansive like thing that they do, but how do you see your role? I guess that's my question.
I don't
And if
want
you
to
want to
answer
start,
all the questions. Come on, ladies, come on. The thing that came to my mind was choice. You
Mhm.
probably folks think hospital birth is their only choice, and I'm like, no. There
Mhm.
are lots of choices, lots of legal choices, and so you can once you understand there are instances where I can refuse certain things that are offered. I can say yes with understanding, um, and that the birth team that you're putting together they are in a consultative position to you. You are the decision maker. They are offering their consultation, their level of expertise to make your vision a reality. And we want to help folks ground themselves in the reality of what birth is, what birth requires physically, emotionally, physically, relationally. And so I think choice is where we can move past crumbs to I want to embrace a full respected experience.
Mhm. I would add also that anytime any of us are in need of a service and we need to access that service with, someone who has expertise and knowledge that we may not have. Dee talked about it earlier. There's that power dynamic. I need you to support me in ways that I think that I can't support myself. So therefore, I'm viewing you as the expert. But what I know about all of us, no one knows my body like I know my body. I've had this body my whole life. I know what it needs, when it needs, and there are things that are going on in my body right now that I'm unaware of, but guess who's going to be the first person to know about it? Me. And so I feel that the role of a birthing support person is to empower birthing persons to say, make sure that you recognize and identify yourself as the expert that is working or co-working with medical professionals for this experience, because after your time with them is over, it is all on you. I just had a conversation with my daughter that, no one really tells anyone within the birthing experience, guess what? You're going to be the nurse, the doctor, the all when you bring this little infant home. And so, how often are we truly preparing people for that? It's take this little bundle of joy home and do the best that you can, on top of all of the other things that you may be impacted with. So I think from the very beginning, empowering not just the birthing person, but their support people, the entire family, whoever is going to be in this child's life and in this mother's life should feel empowered to say, I'm the expert in me, and I'm going to have to be the expert in my child, and I am accessing you for information, but my opinion matters, and it should be the loudest voice in the room.
Wow. Thank you for sharing that. And Dani, how do you see your role as a doula?
So I'm thinking about values, and I'm also thinking about community. So starting from the mental health aspect, um, this is meant to be a community oriented process. It's not meant to be an individual experience that this one person is having. However, I do believe it is up to the individual to recognize like everyone's been saying, what is the experience I desire to have? Um, and then the doula can come in, and I would come in and be able to humanize the experience of, yes, there are these systems that are harmful, and those are the same systems where we go to receive certain medical help or guidance. So me being able to come in and address, what is safety for you? Do you feel safe, or do you have your needs met right now? What is your support system right now? Like humanizing this experience of, there's a lot of change that's happening, and there's going to be even more change happening. And there's a lot of information everywhere. We have lots of access to the information, but what do I do with all of this? Am I going to be good enough? Like, these things that are that lots of people think about or contemplate, how do we know if we feel like this is an isolated experience we're having? So having a doula can really be a companionship, a relationship that is there along with you in the journey. So when you do go home with that bundle of joy, you can remember you've been with yourself, taking care of yourself this whole time to get you to this point. And now that there is this dependent needing you every moment, you can still remember that you have your needs too, while you're taking care of this new responsibility and all of the needs that come with it. So having that safe landing during the vulnerable stage is a great time to have the doula, because you'll do it on your own eventually. It's okay to need support and need help, because this is meant to be a process where you're in community, safe community.
Thank you so much for sharing that. Yes. And I do want to touch on something that Coach Yolanda mentioned about viewing ourselves as experts, right, of our lived experience. Sometimes when we enter hospital settings, institutions, right, in general, it's like a lot of us have been socialized to view this person with this title as the ultimate authority. And so how do we begin to kind of unlearn that and come back into our bodies, right? And realize like, no, something's wrong. This like reminds me of Serena Williams' birth experience, right? Where she had to advocate for herself, like, no, something's seriously wrong when no one was paying attention to her. So how do we begin to kind of unlearn that and be like, no, I know what's going on with my body and something's wrong, and then advocating in these situations? How can doulas assist with that?
The birthing time, the pregnancy is a unique experience. I don't think it can call forward an opportunity with support, with doula support, to learn a skill that most of us don't get an opportunity to learn. We talk about how we don't talk about financial education at home. Nobody's talking about how do you operate within a medical setting to prepare yourself for a conversation with your doctor. How do you prepare yourself for a visit? The structure, the way that in the United States, specifically, the way that doctors' appointments are structured, you can go prepared with a set of questions. You can go prepared with symptoms that you're having. You can go prepared with a plan that you're presenting to the people that you're working with. I think there are not enough women that are practiced in articulating the trust that they have in knowing their own body. Okay. I think there's also a lot of my doctor said that we've just kind of from the pediatrician time, just nothing interrupts that. But I think the pregnancy experience, the birthing experience can be that interruption that I have seen as I come along with people, that they become bolder, that they start questioning. The most powerful words that a mother can say is this medically necessary? Those 4 words puts you in the driver's seat and doesn't have you accept what is being advised. When you say, is it medically necessary? This is a skill you can take forward to your child's pediatrician appointment. Hey, many of us are navigating menopause. I'm asking those questions. Yes, you can prescribe me medicine, but is it medically necessary? Are there behaviors? Is this related to stress? When we begin to, and sometimes that can be a threat. And so having a doula helps you to prepare for those kinds of conversations. And then it also, when you change the power dynamic, sometimes you can see a different response. The person that you thought was an advocate for you, someone that you thought was going along with this plan you were presenting, now starts to say, man, you come in here with a lot of questions. Don't you trust me? Oh, we're going there now. So I think this creates the opportunity. There are people that are bold. There are extroverts that have always been able to speak up for themselves. Many of them are the ones that find doulas. But those of us who are more introverted in nature, we battle with people pleasing, the power dynamic, just the force in which I have to push for, advocate for myself is emotionally draining. When we're already emotionally drained in other parts of our life, can be a struggle. A pen and paper and a recorder. So I gave you the 4 words. The other powerful thing that you can do is take somebody with you. When they know somebody else is recording the experience and will be able to document that this was said to a patient, they were disrespected in an environment, it's revolutionary in the patient care, the patient-centered model.
I would like to add that, at least here in the United States, we have to be serious that the healthcare system is not about the care of anyone's health at this point. It is a business. It is a business. We are lucky if we see a physician for longer than 15 minutes, knowing that for many of us, I can't explain everything that's going on with me. You're only asking about what's going on in my body. I've got things going on in my life that are impacting what's going on in my body, and you haven't even asked me about those things, nor do you have the time to even listen or hear. And so I think having, as Dee said, someone go with you, hopefully the someone that's going with you are your ears, your recorder, going in with a game plan that says, listen, we may only have 15 minutes. We may not even see who we saw last time. What is it that we want to get from this experience, so that the both of us are on the same page? Because this is a business. Their job is to get us in and to get us out. And as we've all been saying, that's not the only experience. That's the experience we're familiar with, but that's not the only experience. And if you know that you desire a different experience, then that may mean you have to do things differently. You know, if I'm going in for a wellness check with my general practitioner and everything is fine, I may not be as prepared as I am if I'm going in and I know that there's something going on with me serious, that I've done my research, I've done my work, and I want these questions now have to be answered. And similar to what Dee said, you it's not that you're challenging. This is your body. This is your body. This is your baby. And the birthing experience can be literally life or death for both mother and child. And if anyone is going to be, you know, invested or in this care team, then you have to listen. You have to understand how serious this is for me. And for most of us, we don't always access health care unless there's a crisis, unless we're feeling poorly, unless we're feeling, you know, bad. So we're used to having that experience of, I am in a vulnerable state, I don't feel well, let me go to the doctor. Doctor's going to give me what I need, and I'm out. And I may get a prescription and I might feel better in, you know, 10 days. The pregnancy experience can be very, very different. And so it may require us to approach it differently. And I think that's something that a doula can do, not just for the birthing person, but for everyone that is going to be supporting that birthing person through this process. It's going to be something, I think, you know, you're going to have to learn. Once that bundle of joy comes, now you are advocating for that bundle of joy. Once you start going to the pediatrician, this becomes something that you may not have done before, but now this is what it is. This is part of this new experience. And so I think trust has to be there, but if you don't find trust, then you have to create a game plan for yourself so that you can get the care that you deserve.
Thank you so much. Yeah, Annie, you mentioned it's been a year, I think you said, since you participated in your first live birth as a doula. So congratulating that. Yes. I want to ask just a similar question. Like, what do you see as, like, what was that process like? I do want to ask that because people may not be familiar with the process of hiring a doula, right, to assist with the birth process. So what does it entail, I guess, just for the basic understanding of working with a doula if you are preparing to give birth?
Yes. So if you hear a doggy howling, yes. Okay. So there are many different ways that doulas, especially now, have set up how people access their services. I personally, as a doula, I went through my training, and then I went to my I went through my local birth center. I literally just asked, can I take a tour? I was like, I'm a new doula. And I just want to be able to connect in community with other birth workers. And it was a local ran organization that was ran by midwives. And so it was an immediate fit, and they actually had a doula directory. So some local birth centers will have a directory where they connect and partner with local doulas in the area, and then they'll have it's like a reference sheet essentially. And so for me, I was a team. It was like a team format with the midwives, and so my family that I connected with, we had a consultation. So first we connected, we had a FaceTime, and it lasted about an hour. And I did tell them that this was going to be my first time. And that was personally my biggest worry. I was like, who's going to choose me to be a part of this very, sacred experience? And I hadn't done this before. So anyone who does think, have that worry, it's okay, and keep going. Okay, because when I told them after we had a really good conversation, they were actually shocked at first. They were like, oh, this isn't your first experience. And after they chose me a few days later. So I will also say, for people who are new to the process, it's okay to shop around. It's okay to meet with multiple doulas before you choose which one, because you get to see and experience what do you offer. And also consider, again, what are your values? What do you desire from your experience? You can start looking around for doulas even before you're actually in any trimester. You can start just looking. If you know that you want someone to be a part of this experience with you, you can start getting to know different personalities. Maybe there are birth worker events near you. So that's something I would say about the shopping around, the consultation. They ended up choosing me a few days later, and I did ask them what how did they feel called to choose me? And she said it was very important that she felt she was babbling, but when I would speak with her, it was like I was pointing out the needs that she was saying that she would want met, and it felt like a very good connection. So someone that you can be vulnerable with, someone who really is listening to you and is able to hear the needs and, you know, go along with the things that also you're wanting from your experience. So I took a few like prenatal visits. It's really what that doula offers. So again, like being clear on what you want as a family as far as support goes. But the birth experience was very nice because I actually was at a birth center. It was in a room, so it was enclosed. It was the midwives were there, and so it was a very unique experience as far as how much of a team I was a part of, along with being her doula. So got to have a nice time with her. Mm-hmm.
Thank you. Thank you so much for sharing. I do want to read a comment from BM. Hello, reflecting on my experience with tears. I'm so glad that future moms to be will have this knowledge and resource. Yeah, and I think that's the purpose of this discussion. Just what has been shared already, right? Showing that there is the option to work with a doula, to advocate for yourself, for your family in a very vulnerable time, right? And doulas, and just learning that doulas can be used in different capacities as these shared, training as a death doula, which is a huge topic that I would love to talk about in the future too. But yeah, it's important to have this knowledge, this understanding,
Yeah.
right? And
May
prepare
I
yourself.
also
Mhm.
share? I wanted to touch on the mental health piece around being in this position where you're advocating for yourself now, and you're really in touch with your body in ways you probably have never been this in touch with your body in your whole life. And I just want to hold space for it's okay if things like if anyone has any childhood trauma, or they have some repressed emotions or just memories that start coming up. It's okay for now that you're in touch with your body, for it to feel intimidating to continue forward and recognize all of these things from maybe the past. It feels overwhelming. A doula and just having safe support systems around you is really, really important. I think it is pushed a lot that people can go through this alone. And sure, while you could, it is just for your own safety, just like you're looking out for the safety of your child and you're looking out for your safety in the medical system, you're looking out for your safety everywhere else. And just remember, keep in mind that sometimes if it starts to feel unsafe within because things are starting to come up that you didn't recognize before, it's okay to it's okay. That happens. I just kind of wanted to mention that there are lots of people that I've had conversations with, and they start having memories or dreams or things of their childhood, and they start thinking, well, I wish I was looked out for like this, the way that I'm constantly advocating. I wish someone advocated for me in this scenario or this scenario. And I just want to, bring that into the space as well, the mental health component.
Thank you for that. That's so important. That's so important. Thank you. I do see a comment I want to get to. Yes, Carol Prov. I think, yes, what are the social determinants of health that are influencing maternal health outcomes are questions that doctors should ask. So I do want to get to the next question of the systemic issues that exist, which were already touched upon, right? But in the U.S. has the highest maternal mortality rate of all high-income countries, right? With Black women being disproportionately affected. I do want to ask the systemic issues that contribute to this crisis, as you all have seen as doulas, if you all would like to speak to that.
I would, like to say, any one of us, when we go to the doctor or a new physician, they want to get a complete history. They want to know about your maternal side, your paternal side. They ask, what things may, be in your family. And then it feels like that information is stored somewhere and never brought up again. As someone who has just um, gone to a new physician, there was paperwork upon paperwork where I'm going all the way back to my great grandparents to say these are things that are present in my family, only to realize that information very rarely comes back up in conversation when I am faced with particular things that may look similar to something that generationally may have been within in my family. And so if you have information, and that's why I think it's so important, because let's be honest, within our community, sometimes when someone is sick or they're dealing with an illness, they may not speak about it. You may not know about it until later on after that person has transitioned. It's important for us to talk about the illnesses that are within our families, because that it could impact your birthing journey. And so if you know that you are, within your family, there may be high blood pressure, hypertension, sickle cell, cancer. If there are pre-existing conditions, those pre-existing conditions need to come to the forefront so that everyone can start to discuss them before we see things pop up. It's always interesting to me when people are surprised. Oh my goodness, your blood pressure is so high. Well, did you not look at my family history? Did you not look at what things may have been under the surface that pregnancy may amplify? And I don't know. That is also an individual question, but I know in my experience, I feel like I often will talk about the history of the pre-existing conditions that may or may not be in my future, but it's not always talked about. And so I think for those in the birthing journey, knowing the history of, things that are going on within your family and also within your community. We talk about access to healthcare. Access can have so many different definitions. It can be something that means one thing to one person and something to someone else. And so when we look at why we have these disproportionate numbers, whether you are a birthing person or not, the health disparities for our community are there. But when you are talking about birthing persons, it is amplified. And so I don't think it's very difficult for any one of us to come up with 4 or 5 different impactful things as to why health disparities are present. We can start with racism. I mean, that would be the obvious one. And many of us don't want to talk about that in relation to healthcare, but it is present. It is present, it is prevalent, and it is something that isn't always discussed or talked about, because I think sometimes we put medical professionals on a pedestal. They've taken an oath to make sure they do no harm and to care for all of us. But humans will always be human. No matter where you go, humans will always be human. And whether the bias is intentional or not, the biases are there. And they absolutely impact the way in which we not only access healthcare, but the way we can almost in many ways feel disconnected from the healthcare experience, particularly when we're not being listened to.
Thank you so much. Would anyone else like to speak to that? These systemic issues, maybe that you have even witnessed, right, play out in the birthing experience as a doula.
I was writing down a bunch of things. Let's see. So I'm going to pull in my HR hat here. I have worked in human resources for greater than a decade. And so what I'm beginning to recognize, more than just the papers that and text and research articles, we are seeing a combined effort that does not support families here in the US. So let's just kind of give some broad examples of that, in comparison to other countries that do. Okay. So parental leave here in the US is, it is not federally mandated. And if you are eligible, if your employer, is in the eligibility criteria for Family Medical Leave Act, that preserves you having a job, not your position at your job, and it does not include pay. And so states are making a difference. California, New York, paid parental leave. When you consider that in the first trimester, they're going to the doctor once a month. And then as they're getting closer, second trimester, they can go every other week. Into the third trimester, as they get closer to their birth, they're going to the doctor every week. That's a lot of time off work. And so if we don't have the infrastructure, and we're talking about going to the doctor. I'm going to share some stats. Okay, so I live in the state of Alabama. We just got the ability to legally have midwives certified with the state 5 years ago. Okay, so the birthplace of midwifery. If you talk to a doula, you talk to a birth worker. The cradle of midwifery was here in the Southeast. Okay, and this is what we documented through the Alabama Midwives Alliance. Alabama continues to suffer from one of the highest maternal and infant mortality rates in the nation. In Alabama, 43 counties lack a hospital providing obstetric care. 43 of our 67 counties. Okay. 23 counties do not have a single pediatrician. When we're talking about the systems that support healthy mothers, healthy babies, people having to drive 4 and 5 hours in labor to a hospital, we can see why some of the birth choices of a cesarean birth, which is major abdominal surgery, has to be the choice because there is little choice where they live. Food deserts impact healthy babies and healthy mothers. Food deserts are not only, I don't have a grocery store in my neighborhood, but my food choices are more expensive and lack the nutritional things that a mother that is growing a whole human would need to sustain and knit together a healthy life. The workplace itself can be fraught. I mean, my sister is a manager. Her manager underrated her performance because she suspected that my sister wouldn't be able to take more off of the director's plate because she was pregnant. Please know your rights as a pregnant person, okay? Here in the US, the ways in which we work, the hours that we work, being on your feet or sitting down in a chair, do not give birthing people the things that they need and set them up for health issues during the birthing time, during the postpartum time, if they can take time off. My beautician was pregnant and I didn't know. It wasn't until then that I found out she came back to work a week after. She said, I don't have anybody. I got to bring my baby to work. And if I'm not earning money, I can't provide for my household. So there are such gaps in the way that people can care for themselves and for their families during this time that just are fraught. If you're on your feet, I can't even imagine going back to work after a week. Like, I feel like all kind of things are going. I was I was some kind of way, and went back 3 months after. I was like, if you go, yeah, housing uncertainty, rents going up. Y'all, when we talk about the systems that impact birthing people, there are so many things that touch their lives that I would hope that a doctor could handle, but I know they're not trained. Yes, we have the terminology of social determinants of health, but outside of the body, doctors are not integrating what we know about the brain and what we know about the body. So how do you expect for them to say, here's a place that you can find safe housing if you're in a domestic violence situation? Here's where you can find food, healthy food. Here are safe places if you're going to walk to lower your blood pressure risk. Here are safe places to walk in the community in which you live. Those are the things I think are what can tie a relationship with a physician closer to their patient because they understand the lived experience, or what you just missed it. You missed an opportunity because you don't have the time or the training to connect and understand who is coming into your space for more than just physical care.
Wow. Thank you. Thank you so much. And Dani, please.
Yeah, that's where that doula can really come in, and just know, like, having your support system to be a part of your community. Because yeah, that's really dehumanizing to know that it feels a bit like gatekeeping a bit. Like, I don't really know your language, but we're talking about my body. And I'm the expert in my body, and I came here to get help, and I feel like I don't know what to do with what I was offered. Like, what do I do with this information that I'm low in this or that? I don't know what that is, first of all. And also, I feel a bit overwhelmed because how am I supposed to improve those things? Like, having someone be a part of that learning curve, be a part of that experience of, I felt dismissed in there. And I need to process that before I start thinking about solutions. And also, please help me find solutions, because I'm actually in a food desert, and the doctor doesn't want to hear about that. But the doctor also said I need to have more a more nutrient rich diet. Like, multiple things can be true at once, and you can receive support. I just wanted to bring that in as well, because, oh, Dee, thank you so much. I'm like, this is what I literally get excited to research these things, only because I know that that will help me build confidence. So when I'm in the presence of someone who will benefit from me doing that research and just being able to show up in the moment, a doula prepares themselves so they're able to show up in the moment with someone else. Okay, that's what I have to say.
Thank you. Thank you. And yeah, I see a comment from Sam that I wanted to read. We can take up to 18 months maternity leave in Canada. I'll take that and pay high taxes. Yeah. As you said, Dee, not even having anything in law, right? That these things, maternal leave, parental leave, are required. And so some people having to return to work a week after giving birth is like egregious. Like, that just makes, I don't think there are any words for that.
I mean, I hate to talk about the elephant in the room, but Black bodies in this country was never about care.
Mm-hmm.
We were not ever considered in terms of care. We are here to work, to serve, and to produce, even if it means till the day we die, you know? And so I think for us, for those of us living in the United States, particularly right now, I think that dream that we have, that at some point in time we will be cared for, supported, and loved, this country was not rooted in that for us. It was never designed like that for us. So it's important that we do that for ourselves. And I also want to say, I think, we were talking about the birthing process could be solo. It was never designed that way. Indigenous cultures have always done communal birth from the beginning to the end. And so, having a doula and having that type of support, that community support, is really inherent to who we are as a people. And I think if we also put that at the forefront of our mind, that this is who we are, this is who we've always been, and getting back to those practices. um, Dani, you brought up such a great point. Even today, as I was gathered with some other doulas, and there's information and brochures, and I had to put myself in the shoes of a birthing person who, goes to their physician's office, receives all of this information, and then says to themselves, as Dani said, I can't do this. How am I? You're giving me a diet? How am I supposed to do that? And what does that do to you as a mother when someone is saying, this is how you should be successful in this birthing journey? And you're thinking, there's no way I can do that. I can't buy these groceries. I can't even get to where I don't even know what this is. You're telling me I have to eat this amount of calories every day? That's not my life experience. And so I think the medical profession believes that it's doing a great job. We're giving the information, we're providing the resources, but there's still that disconnect that you're not listening to the needs of people. But I just wanted to remind us that our needs were never anyone's top priority or concerned in this country.
Absolutely. Yeah. Thank you for that. And I know that, Dani, you have to leave in a few minutes. I want to make sure that people have your contact information, how they can subscribe to your channel, if you're offering doula services at the moment, anything that you want to share around that.
Yes, so please, I will be keeping you all updated on me building my business as far as offering services. But for now, my YouTube channel, teatime.beauty, is a great place to connect with me and stay updated. I put all of my updates on what I have going on there. But I also want to offer that breath work is something that is free. It's accessible, and it helps every area of life. You can do it at any time, and you don't have to ask anyone's permission to breathe slower and deeper and just to slow down. Slow down. Okay, you are your number one priority, and we can all start there. I think there's a lack of trust, but also there's a lack of self-trust first.
Mm-hmm.
I've just been seeing that a lot, and even within myself. So as I learn more about the importance of community, I look more at myself and how have I allowed myself to receive community.
Mm-hmm.
Yeah. How have I pushed away community because of fear?
Wow. Mm-hmm.
Yeah. So transparency, that's why I'm at where I'm at with my business. I've had many people want to have my services, and I'm like, oh, I don't have it set up yet. And that's part of me protecting myself. It's a fear of success. People are saying I'm offering things that are in need. People do need to get back in touch with their body. Yoga and breath work will and has already transformed lives. It's transformed my life. All I need to do is share it, and I need to support myself to set up the process. So I can't be going around being a doula telling other people, you can do it. You can set up structures for yourself. I'll do it with you. And then I'm not looking for my own community and setting up my own structures to support myself in order to be there to support other people through their moments of transformation. So thank you again for letting me to be a part of this panel. I learned so much, and I hope to be where you ladies are in your doula experience. One day I'll be like, I've done all of these things, but I'm glad we have this documented. This is the beginning.
Yes.
Like 1 year in.
Beginning. Mm-hmm. Mm-hmm. Thank you so much, Dani. Thank you for your transparency around that. Very healing. Thank you.
Yay.
Appreciate you being here. As always, please subscribe to Dani's YouTube channel.
Okay, thank you.
Bye.
Bye.
Absolutely. I do want to ask, with the systemic factors that we laid out, how doulas specifically can protect, that's the word that's coming to me, protect Black people who are birthing, Black mothers within racist hospital systems. Anything that you all like to share around that? I know that's a really big question, but yeah.
I shed tears every time I'm in labor and delivery waiting room and a mama presents without someone. A lot of research has gone into to document the impact of having a doula in the space. And so what they did was they actually looked at things like the length of labor all the way to patient satisfaction with the experience. What they found is that just a person in the room, you don't even have to be trained in birth, having someone with you can make a huge difference in your experience. Not to get too deep into what happens during birth, but we kind of go to a more primitive brain where we step out of you should step out of the logical brain into more rudimentary orientation. Okay. And so what I ask moms to do is to tune in, and that your partner is able to articulate your needs. You all come up with a system of communication so that the birthing person can stay in that basic brain space, which facilitates the hormones of labor and things like that. And so there is document that please just take someone with you. That can mean a lot. Because I had a doctor, my own experience of mothers. You can wait to ask me a series of questions in the gap between contractions. Like somebody to just say, can you give her a minute, can make a huge difference. Protecting the space also looks like birthing is deeply emotional. You are tapping into yourself in a deep way, regardless of if you have medication assisted or with what do you call that? Without a birth without medication, labor without medication, and so. If you're navigating an emotional space, you need someone to lean into. You need a place to put fear, distractions, and I think building someone that's helping you to build a protected space. We turn the lights down as doulas. We put up the Christmas lights. Creating that low light environment. There are sounds, there are pictures, there's smells, essential oils that can be brought into the space to actually create a sacred birthing space that matches your ideals for that. So it's literally protecting you, the physical individual, Someone mentioned episiotomy, and I want to address that here. Episiotomies happen for a variety of reasons. Shoulder dystocia is a major concern when a baby is born, and when they make the turn that they're not able to dip that shoulder out. And so sometimes an incision to widen that because the body cannot stretch is usually what sometimes is pointed to. But with a doula, you understand what your options are that reduce the chances of you needing to have an episiotomy, but also to be on guard for a doctor. One, to ask, what is your episiotomy rate? When do you decide to do an episiotomy? Or literally saying, your doctor has picked up the scissors. Do you want an episiotomy? Is there a different position you can be in where the coccyx, which is the bone at the bottom of the spine, so that the coccyx can move and you can create a wider diameter for the baby to come through? Side lying, laying over the back of the bed on hands and knees. Y'all, there are so many. On the back is, you should never birth on your back. You should never birth on your back. And knowing these options protects your right, protects your ability to know what is happening. Even in a surgical birth, and that's what we call a cesarean, it is a birth. It is a surgical birth, but it is a birth. How can I protect my ability to be skin to skin with my baby? For the baby's first sound to be the mother's voice, the father's voice, to protect the ability for the father to cut the umbilical cord. Y'all, if you aren't having someone to build out those options and say, regardless of what situation or circumstances are presented, we're going to protect your right to be an involved, vocal part of the decision making, knowing that emergencies happen, but someone should be telling you as they're wheeling you back what's happening and should answer your questions to your satisfaction. That is how, we protect the birthing space. I don't want to miss the opportunity to talk about also, as a part of the protection, doulas in many cases are a private pay option. Many states are adopting a way to cover through Medicaid a level of reimbursement. It's varied across the country. I'll put in the organization that's listing what is available in and happening at states for that. But there are other ways that you can leverage if you have an employer through your health savings account, your FSA, I'm sorry. So your FSA or HSA that you can be reimbursed for those funds that are collected through that mechanism. And so your doula is a paid service. You know why it's a paid service? You see what we're talking about that we do? We spend hours. A birth is not a 1 hour clock in, clock out, 12 hours, 18 hours. I hire a backup doula so that you have a fresh person that's got fresh energy that I can consult with. I just had a birth and I was so thankful to have that. But that structure, the hours that we put in before the labor, during your labor, and the postpartum time, I would gift that to the world because this is my heart work. But y'all, when I step away from my family, from my work, doulas cannot be poor. What I was reading to you from the statistics was from a post from a midwife saying, I can no longer afford to be a midwife. People cannot pay my minimum rates. It is not an affordable option. And the laws and regulations that I have to maneuver, the documentation, all of that goes into the having a doula. And so we want to protect the birth space, and a lot goes into our ability to be able to do that.
Amen, D. Doulas cannot are not always self-sustaining. Many doulas have other roles in their lives because simply relying on that as a source of income is not always feasible. I will say that I am blessed to live in a state that takes the role of doula seriously. As the event that I was at earlier, the clinical director of the maternal child health for the state was present. So when you have stakeholders who are invested in making sure that people are being cared for, it it really makes you feel like, okay, I have skin in the game. Like I can stay in because I know that my work will not be in vain. But it doesn't mean that we are always listened to. I think sometimes the medical community lags behind because they're seen as the only players on the field. So, although it is not in every case, because there have been great experiences with medical professionals who will open the door, welcome you in. I can tell you, um, going into a hospital at 2 in the morning, and the nursing staff said, "We've been waiting on you. Mom is ready." Like, I'm like, this is not anything that I thought I was going to experience, and I'm so grateful that the team, and when I say team, I mean my birthing person and I said, you know what, where you were is not going to provide you the experience that you desire. So we need to move to a place that has a documented history of supporting birth in a loving way, because they have doulas on staff, they have midwives on staff, they understand the importance of all hands on deck. And so, as Dee has said, one way that we can prepare is the conversation that we have prior to labor and delivery. It is an ongoing conversation about what is it that you would like to experience, but also knowing that this is an unpredictable experience. And you may think that you're going to have, the room bathed in a particular light and the music, and I want to have my nails done and great, wonderful. We can shoot for that, but just know this baby gonna come when this baby's gonna come, and we may not have time to ensure that all the bells and whistles are in place. So what are the core values? What are the core values? And for, one of my birthing mothers, it was not the experience that we had designed, but one of her core values that was that it be calm and that it be loving. And it was that. So we may not have had all of the bells and whistles, but everyone in that room was doing the best to make sure it was calm. It was quiet. There wasn't a lot of, no one person in that room was more important than anyone. We were all there to do one job, to bring this baby into the world, into a particular energy and into a particular experience. So the conversation about what's going to happen at the end starts at the beginning, but you're also building to understand that I may not get everything that I desire, but if there are things that I'm not going to waver on. What are those things? What has to be
Thank you so
present?
much.
Because that can also impact the postpartum experience. I, my oldest is 30 something. I'll just say that. And I still think back to that experience like, oh, I wish we had done this, or oh, I wish that hadn't happened. Birthing experience is one thing that once it happens, but it can also bring up a lot of guilt, a lot of sorrow when particular things are not done the way that we have imagined and envisioned them. And having a support person, having a doula is also important in that postpartum time frame, because if I've gone to this elevated experience and it didn't happen the way that I wanted it to happen, I am now carrying that. And you want to make sure that there's someone that's there to support and to care for for all individuals who may not have gotten the experience that they desire.
Mm, thank you. First, I want to thank you so much, both of you, for being here. Um, this conversation has been so powerful. And I know there's so many more topics on my list to cover, but yes, this is a continuing conversation. But yeah, I want to ask if people are interested in seeking your services as a doula, if you're still offering them, how they can get into contact with you, and then also connect with you on social media if you'd like to share that too.
So I'm Big Sis Doula on YouTube. I took my last US client, um, and just as a matter of fact, she just turned 6 weeks today.
Oh,
So
wow.
I am spiraling down so that I can focus on my move abroad, and I'm
Mm.
hosting. I will kick off hosting the virtual doula space. It'll be a community for people who are choosing to birth abroad, so that they can have a community of people who understand that lifestyle and need help learning to navigate the international birth space. Questions that they can ask: how to find a doctor, is having a midwife legal there, finding pediatricians. We're just trying to create a space that allows the things that a doula would do on the ground. So with childbirth education, birthing in community, preparing for birth in community can happen virtually with that particular population, because I hope to join them later this year.
Exciting. Thank you for sharing. Coach Shalon?
Oh, Marissa, you know how much I love you. Thank you for this opportunity.
Mhm.
And again, you chose World Doula Week to highlight all of these issues. And for me, I am a doula coming off of a pause. And so as I ease back into my practice, I do want to primarily focus on the postpartum part of the birthing journey. I am also a certified spiritual life coach. And so the experience that I had with my daughter is the experience that I would love to replicate in the lives of others. But I'm always available for resources, for information. I am no longer on YouTube, but I'm still on social media, on Instagram, where there's so many different things going on in my life. And as I said, the event that I attended today, I am in contact with so many wonderful doulas who are ready to work, who are willing to work. Here in the state of Delaware, uh, the relationship the state and the Medicaid program have with doulas is continuously growing. We also are covering women who are incarcerated to also receive doula services. So that's also something that I'm looking forward to jumping into. I mean, the minute I stepped in the door, they're like, how do we get you to work? So I know we talked about a lot of things that seem as if the birthing experience is a scary, horrific experience to have in the US. It does not necessarily have to be that way. As Dee said earlier, there are other options. There are a variety of options for individuals who are looking to have um, a wonderful birthing experience that's close to their values and the principles that they hold dear to them. And I would just offer to everyone, do your research. Do your research. There are a lot of grassroots organizations who are supporting doulas, who are providing free doula care. Most of the doulas that I know have come through those grassroots organizations. And I think that is going to be the way in which we all communicate, that self-contained care that has always happened within our community. I think that will continue to happen, and I think it will increase because it will need to increase. We are going to have to rely on one another for communal care. We are
Yes.
going to have to rely on one another for many things. And so research the grassroots organizations that you may not know of. A lot of these organizations work on grants or sometimes are not working on or working on very little. And so you may not know about them, but they are out there. And I'm grateful that because of them, was able to become a doula. And so anyone looking to find one, I can be a resource, but I'm also, again, looking to support those in the postpartum experience.
Thank you. Thank you so much for sharing. Okay, as we're winding down, I want to first thank everyone in the chat for sharing your experiences, resources, information. So if you're watching the replay, please go back and look at the chat for those. If you are watching, please like this video so that it's shared with other people, specifically Black people, right? Navigating the birthing process in the US, which, as we have talked about, a lot of systemic issues, right? And ways that doulas can assist, can advocate, can protect, can speak up. I think Dani shared, like, when you're in a very vulnerable position, just having someone to be a voice for you. And Dee, you shared, like, your brain, right, during the birthing process, and being able to have people who are able to have the conversations to push back against things is so pivotal. As we're leaving tonight, I want to ask one piece of wisdom you'd like to leave with Black women, Black birthing people in the US who are navigating the birthing process, either now or in the future.
Excuse me. I was about to say, you have options. You can choose a provider with planning, even though 50% of US pregnancies are considered or identified as unplanned. Begin to set aside some money for yourself at the top of your registry. I want to pay for a midwife. I want a doula. Can be a part of your plan. Hospital, birthing center, home birth, water birth, birthing on hands and knees, finding a doctor. Doulas can help a lot with the information. What are the questions I should ask? Know what your opportunities and options are. And what I do want to say in this space is, it's not the US for US citizens isn't the only place for you to birth. Sam is in the comments now. She's in Canada. She went to Mexico. I actually have 2 clients who have gotten fertility treatment in Mexico and have birthed in Mexico after having what they would have considered good birthing experiences in the US, but the kind of patient caring and community caring that is a part of just that culture was what that family craved. And so you have options, and that birth is also can open the door to many other opportunities for you and your family into the future. Like your baby gets citizenship. Y'all, I'm telling you, other people are talking about that. We should be talking about that. The Black Maternal health crisis should call us to, where are they going where I can be treated best? And if my community, I didn't even know I could go to the next state over, take my portable insurance to the next state over and have a whole different set of options and opportunities. If I had known what to ask, I could have asked the right questions, better questions, more thought-provoking questions that would have helped me to be a better helped me to better navigate the clinical side of the birthing process and the care I received during the postpartum time, which is completely overlooked, I think, by the medical establishment in the U.S.
Thank you.
Amen. I would also say that Black women, we have a tendency to be so forgiving, so loving. So I'm going to give you one chance, second chance, a third chance, and hopefully you will get it right. When it comes to the care of your body and the care of your children, you don't have to do that. You don't get 2, 3, 4, 5 chances to not do right by me. You just don't. And so we, I think, have to remove the fear of upsetting someone or hurting someone's feelings. We have to consider ourselves first. If you are in an environment, whether it's the medical profession or any environment where you are not being listened to, not being heard, walk away. Sometimes we need to run away from those environments that are not supporting us, that are not listening to us, and that have absolutely no investment in what is best for us. And it may upset some people, but they will get over it. You have to do what's best for you and your family. And I think we should also remind ourselves of who we are and who we come from. We do not come from what people think we come from. We come from communal living. We come from places and spaces where birth, where life itself, and even the experience of death is sacred. That every human life experience is sacred and should be treated as such. And if there are individuals who do not see it that way, then those are not the individuals you need to see. And do whatever it is that you feel necessary and what is within your capacity, because we have to recognize that not everyone has the capacity to do some of the things that we have talked about. Not all of us have the capacity. Many of us are dependent upon whatever health coverage we have, and we're, limited to what that coverage provides. But there are options. There are, as I said, grassroots organizations where you may be able to have the conversation that says, hey, I cannot pay for a doula, but what information and resources can you provide? There may be books and there may be a sister who's not even a doula, but has had one that can say to you, well, this is what happened to me. I think that's also important, that we have to continue to share our stories. We have to continue to talk about our experiences so that, number one, we don't feel alone, but that we can learn from one another. I just saw someone in the comments said, I never even thought about putting a doula on my registry. So if we don't continue to have these kind of conversations, then we're really not going to expand our knowledge and the options that are available to us. And so we're going to have to get creative. It's unfortunate, but it's necessary to sometimes get creative so that the experience that we desire to have is more obtainable than to just say, well, it's beyond me. Recognize how powerful you are when you put your mind to it, because that's who we are. That is who we are. Inherently, that is who we are. And so my hope and desire is for those who are either in the birthing journey, out of the birthing journey, no matter where you are in that journey, support someone else, love on someone else, pass along the information, and do whatever you can. Those grassroots organizations might need a couple of dollars. So, find one and support them. So even if you are not in the market for a doula, there's a woman who probably is, and you may be able to support her in doing that. So I would say, remember who we are. We have always uplifted one another, and I believe that we will continue to do so.
Well, thank you so much. This has been life-changing, and I'm sure people who are watching now feel the same way. So thank you so much for sharing everything that you shared tonight. I hope this will be like a continuing conversation because it is so important. And just to know, like you said, that you have options. You don't have to take the crumbs that are given to you, right? You can explore those options, and prioritize yourself and your family, right? And your health, because it's essential. And yes, I love this quote: recognize how powerful you are, truly. All right, y'all. I want to thank y'all so much for joining tonight. Again, if you're watching the replay, please check the chat for resources. Dee has been dropping so many resources tonight, so thank you. And yes, okay, Black Maternal Health Week, April 11th through 17th, 2025. Thank you for sharing this. And yes, I think that's it. I have so much more to ask, but I know we're at time. So thank you both for being here. Again, I have all the links in the description section. And yeah, until next time, y'all. Thank you for being here. Bye.
Thank you, Marissa.
Thank you. Bye.